Hi, I'm Joe Fifer, President and CEO of HFMA. Welcome back to our web video series. This month, I'm talking about reconfiguring cost structures. We talk a lot about the need to contain or reduce healthcare costs. But healthcare systems today also need to reconfigure their cost structure and invest the savings in the infrastructure needed for risk-based contracting or population health management. These terms are similar, but not synonymous. Both cost reduction and reconfiguration are driven by the same imperative to improve value. But reconfiguration connotes a different way of delivering care. Not at all. In fact, cost reconfiguration and reduction efforts can actually be linked. Cost savings in one area enables increased investment in others. Efficiencies gained by reducing operating costs can both increase margins under existing fee-for-service arrangements and prepare an organization for accepting risk-based contracts. HFMA's newest Value Project report demonstrates that cost containment and reconfiguration can be managed simultaneously. Maybe we should be experts in cost reduction. Frankly, we're not. When we surveyed senior financial executives for this report, less than a third described their cost reduction capabilities as strong. That tells us people are being honest about where they're at with these efforts, which is a sign of strength. Now, I know some of you might disagree with these statements, and that's probably because of how difficult budgets are to prepare. We're constantly focused on taking out a few percentage points here, a few more there. However, our total cost trends still exceed the rate of inflation, unlike other industries. Given that, it's a hard sell to say that we are proficient at driving efficiencies that reach the consumer. A few years ago, we heard claims of 20 to 30%. More recently, those claims have been along the lines of 2 to 3% per year, with some saying these reductions are offset by other investments that net to zero. But that math won't work. Cost reduction efforts can't be a zero-sum game. They must be sustained, and they must result in a lower total cost of care on a per member per month basis. Furthermore, savings should be shared among key stakeholders. We need to create an incentive for further reductions, and ultimately we need to pass the savings on to patients and other care purchasers. This will require an unprecedented level of cooperation among the three circles: hospitals, physicians, and payers. But the potential rewards make it well worth the effort. This is where I see encouraging signs. There's no doubt there's been a sizable shift of focus in our industry that is starting to show signs of working. Sharing financial risk, aligning incentives, and improving quality that also lowers the total cost of care. All these things are occurring at an unprecedented rate. We need to keep fighting the good fight all the way to a consumer benefit. Thanks for watching. I'll see you next month.